Hello and welcome to the EMJ podcast with me, your host, Dr. Jonathan Sackia. Today, I'm delighted to be joined by Dr. Isabelle Amigues, CEO and founder of UnabridgedMD, a direct care rheumatology practice based in the mile-high city of Denver, Colorado in the USA. I visited and I'm a big fan of Colorado. After obtaining her master's degree from Université Pierre et Marie Curie in Paris, France, I have an awful French accent, and her medical degree from Université Claude Bernard in Lyon, which is another of my favorite cities, also in France, of course. Isabelle trained across multiple prestigious institutions, many in New York, Memorial Sloan Kettering, Columbia, and Mount Sinai. She spent the first part of her career as an academic clinician, teacher, and leader in the Department of Rheumatology, National Jewish Health in Denver. However, at age 40, cancer changed Isabelle's approach to medicine. She was diagnosed with stage 4 breast cancer, and her experience forced her to go deeper and learn about complementary and Eastern medicine. At UnabridgedMD, Isabelle now uses a blended approach that utilizes the best in data-driven Western medicine and traditional Eastern healing. Her treatment approach is focused on the mind-body connection, empowering patients and their loved ones through healing and remission. Her motto is hope driven by science. When she's not busy caring for her patients, Isabelle is an avid rock climber. So welcome to the podcast, Dr. Isabelle Amigues. It's a pleasure to have you here.
And thank you so much for having me.
So, Isabelle, just to start off with, I always like to learn something about the people I'm fortunate, blessed to speak with. I love where you live. I love the mountains. I love skiing. I love fishing. But rock climbing terrifies the living daylights out of me. What got you into that?
It actually terrifies me too. I just love it. What got me into that? I think in France, there's quite a bit of climbers. It's actually in the backyard of many places. I think at school, I discovered it at school. And then in medical school, I started rock climbing again. And I had developed the fear of heights. So I would only go a little bit up and I would come down. And a little bit up and then I would come down. And I've actually worked really hard on my fear of heights, fear of falling. And it's still something that I work on, which actually gets me closer to my patients because it's pushing through something that's scary, right? So,
absolutely. I was actually chatting today to a very dear friend of mine who has multiple sclerosis, and he has been an icon in not only dealing with his own journey and his own battles, but being a very vocal advocate for other patients. So I guess tackling our fears is one way, and connecting to our patients is one way of doing it. Isabelle, your journey in medicine, I love origin stories. Can you share what drew you to the field of rheumatology, especially given your experiences?
How much time do you have? Because I really love it. Even through chemo, I continue to be a rheumatologist. COVID, I started doing research again. It's just the coolest field ever, right? So I think that there's a couple of things that I love about rheumatology, like the intellectual stimulation from it. It's so interesting, right? It's like we have patients with inflammatory conditions that are, as you know, coming from their own body, and how do you get back the balance? Why did patients develop something inflammatory? So that's something that I find fascinating. And then I really do love patients. You have this connection with them because you're going to see them for a long time. And so, I think there is that. And then the medications. So I think one of my favorite thing is to get patients into remission. And with all the biologics we have, we can. And so that is, that's actually so rewarding for a physician. So I think, that those are the three things. And I had the choice of choosing something else when I did, again, a residency in the US. I just couldn't imagine going into any other field. I love it. And I keep learning so much. whether it's from a research perspective, new advances, or the connection. I think like we are so much more than just the cells and the biology, and I really think I'm seeing it more and more. The connection between our mind and our body is huge in rheumatology, at least in my patients, like in my experience with patients. So yeah. Love it.
And your specialty, certainly during my professional lifetime, has changed dramatically with the. I mean, I remember at medical school, the only option was steroids and warm wax, basically, and you've got so many options now and so many diagnostic tests and therapeutics. Yeah. I can see why it would be stimulating. So you've bravely spoken about your own diagnosis of stage 4 breast cancer, which understandably changed your perspective on medicine. Can you walk us through that transformative period of your life, how it influenced your holistic treatment approach, and what led you to pull down from various disciplines into a sort of a coalesced whole, if you will?
Yeah, so I think I have to precede this with, we go into medical school at 17 in France, because you go from high school to the university. So okay. From, let's say 17, 18, let's say closer to 18, from 18 years old until 40, or a little bit less than 40, from 17 years old to, mid 30s. The only thing I did was studying medicine. And I extended my fellowship in France. I did research. I extended my fellowship in the US, because I remember this person saying, as a fellow, you're not asked to be productive. You're asked to learn. And I was like, I'm learning. And it's funny now, I'm like looking at it and I'm like, I'm still learning. So I'm so glad. Yes, I have to be productive, but I'm still learning. But I was afraid that I would stop learning if I would come as an attending. So I think that's one of the reasons I extended the fellowships and so on. And when it sounds so cliche, but around a little bit earlier than 40, I had this midlife crisis where I was like, am I really where I want to be? Like, I'm not sure. That the only thing I've worked is to be where I am. And now that I'm here, I don't know that I like it. And I'm sharing this because I think it allowed me to look at cancer, this diagnosis of cancer, in a different way. And, the people you meet, the people you're surrounded with, change also your approach to things. And I was really lucky that I had planned a trip to France, which was one of my first trips to France. It was actually my first trip to France alone, without my kids, without my husband at the time. And I was going to just go for 4 days. And I basically had the final diagnosis of cancer, and we knew that it was at least stage 3 then. And I was surrounded by my friends. And my friends, there are a lot of them in France are not physicians. So one of them was like, well, you're just going to, this is your midlife crisis. You're just going to show us how it's done. And I'm not worried for you. And you it's really funny words, right? Like you hold on to those words. And so I held to her words. Like, I'm not worried about you. You're going to show us how it's done. Even when we found out that it was stage 4, that there was metastasis to the bone and the liver, which is not ideal. But again, right? Like I held on to her words. And one of my friends showed me, asked me, not asked me, but shared, do you want to see my naturopath? And you're, as a researcher, I was like, what the hell? But as someone that had gone through this midlife crisis where I was trying to find myself and I didn't know where I was and I didn't know where I wanted to go, I was like, hell yes, I'll do everything. Placebo is 30%. If this is placebo, that's a good thing. And she actually changed the course of how I saw diseases. And I think I had already started, but it kind of shifted. And she was like, well, you can see the cancer as an enemy, or you can see it as a friend who's coming here to teach you something. And that really changed my view of disease. And the truth is that as a patient, I was like, hell no, I would rather have a friend in me than an enemy. And so it really changed how I saw things, because I was like, well, if I want to see this as a friend, why can't I share this with my patients? So, of course, I don't tell them, see the rheumatoid arthritis as a friend, but I change it and I ask them, what can this bring to you, right? And so I think this shifted fully. I had already seen patients who did so well when really the odds were against them. And I had already started wondering, what is it that some patients that look so affected are doing so well, and some other ones who have almost nothing are doing so poorly. And I realized that their approach to their condition was very different. And so I was like, well, I want to go where the placebo is. I know that someone that gives me a pill and tells me this is going to work, it's not going to do the trick for me as a physician. So I'm going to consider that placebo is brain, and I'm going to see if I can change my brain, basically. And so that's what I did. And I think it really, I don't know. I will never know if it helped on a biological level, although some people would say that it does. But it definitely helped my sanity, right? Like, it helped my mental state. And so, when you're tired and you're not sure if the chemo is going to work, not work, you don't know, just distressing about that and saying, well, okay, I have a friend, let me talk to my friend. And I would be, okay, cancer, I've learned a lot. Now it's time to go. Thank you. Thank you for all your teachings. And I would actually have this talk. When I was very afraid, I wouldn't, push the fear. I would be like, okay, why am I afraid? It's normal to be afraid. And now let's live, because I'm not going to live in fear. Kind of a little bit like climbing, actually, honestly. It's like, yes, I'm afraid of heights, but I also know that it's okay. And the worst that can happen is that I fall, and it's going to be okay. And I think that was kind of the same thing with this cancer journey. And that's what I tell my patients when they are afraid of starting a biologic or a medication, like any medication. I'm like, well, we try, and worst that can happen is that we have to stop it. And we'll know how to deal with whatever happens. And then we have other options. We just try. Yeah.
Your enthusiasm and optimism. I didn't know you before, but I would not be surprised to know that you were always an optimistic, upbeat, and vibrant human being. A very dear friend of mine, she was diagnosed, I think about 6 months of pregnancy of her first and only child, and was diagnosed, and she had quite an aggressive cancer. It was many years ago. She did brilliantly. And she said it was the best thing that happened to her, because she said, I stopped taking even a minute for granted.
Yeah.
She's always a joyous human being, but it said it elevated her to another level. The guy I said I was talking to when we were chatting earlier, who's been an advocate for people with dealing with multiple sclerosis. And I'm also intrigued by your expression about an enemy.
Yeah.
I've always hated that expression about a battle.
Yes.
He is fighting cancer for several reasons. Number one, that's sort of what you're going to turn on your own body. You've got an issue, you deal with an issue. But it also means that people lost the battle. Well, who loses battles? Losers and cowards lose battles, right? And I hate that terminology. I always said similar things to my patients. So I love your mentality. It's joyous. And I'm sure you'll be familiar with the blue zones concept. We know that having the right attitude in life certainly has an effect. So let's talk a bit about that as it equates to your practice. You've talked about the mind-body connection as one of your core guiding principles, the mind-body connection for your patients. Can you elaborate what that means and how it plays a role in the way you treat your patients?
Well, actually, it's actually interesting. I'm still bringing it together, right? But the word unabridged to me, I love that name. It's really funny. It's from listening to books and reading books, and I would hear unabridged, and I was like, what does that mean? And I was like, oh, it just means non-edited version. And in the practice in the US, the insurance system has made it that you have to see a lot of patients. Otherwise, you just cannot survive in that environment. And so then you have to take the patient has this little tiny bit of, we're only going to deal with what, I mean, I've been trained as a resident in the US of, you can't deal with everything. So take one problem and ask them to come back. And I'm like, well, okay, that's great. That's great for me. That's not great for them. And so then I thought, oh, the UnabridgedMD is the non-edited version of me and the non-edited version of the patient. So I can see them as a whole. And so my time, like in the consultation time, is so much longer than what I had before, because you have things that are said in between, right? Like, and I always tell my patients the first time I meet them, I always ask them, do not stop yourself from saying what's on your mind. Just tell me. And I've made diagnosis thanks to that, because then suddenly they'll be like, oh yeah, I keep drinking, but it just does. I just don't feel hydrated. The patient had diabetes, and she had seen 10 other people. And, you know, you're like, wow, like those are words that I need to hear. So it's just the whole of the person. And there's definitely a connection between the mind and the body. There's no question about that. I think the way I'm seeing it in my practice is that I'm bringing my whole self to them, right? Like I love my patients. I truly bring love. And I know that sounds silly, and maybe it's outdated. I do not care. This is how I want to practice medicine. I love my patients. And I kind of want them to love me too. Not to love me. I don't care. I want them to love themselves through me, if that makes sense. And to see that it's not a failure to have a condition, that it's just a passage. And I always use the bridge option. I say, well, you know, we are here, and then there's this bridge that's going to get you there. And that bridge might be medication. And we're going to take, maybe I'm pretty aggressive when it comes to medication because I want full remission. So we'll get there, and then the bridge comes down, and then you don't necessarily need all of those medication afterwards. And so, you know, it's not oh, you need to meditate, you need to do this and that, but it's more this idea that I'm bringing peace to their mind so that they understand where we're going and they get it. They stop fighting with what they have, but we start working together. And I do bring the meditation because I'm a big fan of it. There are some studies that are backing it up. So we do meditation, visualization, writing. All of this is backed up by science, right? And I do share it, but right, like if I just tell you this, that's it. Like you don't need me, right? But it's really more, how can visualization, how do you bring visualization so that they actually understand that, right? So I will sometimes have my patients close their eyes and be like, what is health for you? What does that look like? How do you want to be? And what's really cool is when you can see that they are fighting because somehow they don't think they deserve it. They don't think they deserve to have remission. And so that is the mind-body connection, because if you don't think you deserve it, you're going to have complication after complication when it comes to your medications. And you're going to be so freaked out about the medication that you may not even give it to yourself, right? And so how do we get there? So it's a little bit more than just this, you know, mindfulness that everyone talks about, although I'm a big fan of it. I meditate, I try every day. And I want to do it every day, but sometimes life's busy. So I don't. But yeah, it's a little bit bigger than just those words of mind-body connection.
It's funny that many people are familiar with the expression that, you know, telling a young person, if you think you're going to be a success or you think you're going to be a failure, you're right.
Yes.
And, you know, the complexities, I'm a surgeon, right? So you can't get a more pragmatic approach. Yet I remember some books from medical school days. One was called The Doctor, the Patient, and Their Illness, and the other was called Frankenstein and His Monster. And they were about the way that we speak to patients and the way that patients perceive their disease. And I'm also reminded, I quote this often, Sir William Osler from Johns Hopkins said that a good physician is able, that's obvious, available, it's obvious, but there's a lot who aren't, and affable. Just being nice and creating a nice atmosphere is so damn important. But that's fascinating. So moving on a bit, the motto, as I mentioned in my introduction for UnabridgedMD, is hope driven by science. So how do you maintain a balance between offering hope, having a holistic approach, and maintaining scientific rigor, especially in complex conditions like autoimmune diseases? You did mention writing. I presume by that you meant journaling?
Yeah.
You've mentioned mindfulness. You've mentioned meditation.
Yeah.
Again, I'm a pragmatic surgeon, and I'm one of the most curmudgeonly people on the planet. Yet, when people first told me about them, I was like, show me the evidence. And you look, like, oh, well, okay, I get it. Yes.
Yeah, it's cool. So I think a lot of physicians are burnt out, and at least in the US, we can talk about the US, and I think in France too, a lot of physicians are burnt out. One of the reasons being that we are not as, we don't have as much autonomy as we used to, at least I think in the profession. And so we forget that that is the most important thing in our practice. We have to give hope to our patient. We have to share with them why we are sharing those medication with them. Like if the medication is just just medication, that's not enough, right? And when I built the practice, like I wanted to bring hope to my patients by this idea of I'm not just going to tell you to do woo-woo things. I'm not telling you anything. I'm bringing you on this journey and I'm your guide. I'm a coach. You're doing the work. But how do you work if there's no hope? And so, and then I was thinking, right, like not everyone is going to have the capacity of listening to the words of see this cancer at stage 4 as a friend. How do I share that there is hope even to someone that, me 5 years before, maybe 10 or 15 years before would have been like, well, there's no data for this. And so then I was like, well, there is science behind meditation. There is science behind visualization. There is science behind actually the words we use. That's like, so, and all of the things that I did as a patient that was going through cancer, all of those things, I didn't want to look at the science at the time because I was like, well, if I see that it's debunked, I'm not going to want to do them and they make me feel good right now. So I would rather not know. But as a physician, later on, I looked at them in rheumatoid arthritis because that's a big specialty of mine. And I was like, oh my goodness, there is so much data on meditation. There's so much data on visualization and journaling. And so then that is science. It's backed up by science. It's driven by science. I'm still a physician that's trained twice, that is a researcher. I still, in my core, I'm a researcher. I'm evidence-based, science-driven. Yet there are many things that I know we do not know. And so for me, that's the hope. That's the hope part. Like hope is bigger than just the data. Does that make sense?
Yeah, it makes perfect sense. And to quote, I think it was H.G. Wells who said that to the uninformed, sufficiently advanced science is indistinguishable from magic, right?
Wow.
And there were many things that we have done as physicians in our career that later proved to be valueless, and other things that we thought were valueless turn out to be, bee's knees, right? Yep. So I really admire your approach, and I'd like you to give a couple of examples of things like incorporating acupuncture or mindfulness. Give us some specific examples in your practice, how you use those.
So the first approach I have is really like listening to the patient, because that is the most important, and understanding what's holding them back, right? And then honestly, like I'm pretty aggressive in the sense of we have a lot of tools in our toolbox as rheumatologists. So I will get to remission with medications, right? Like, so we'll have medication with the goal of there's a big fire, you put out the fire, then you can back off. Sometimes there you reach 90 or 95%. And that's when I'm like, well, I don't know. So, you've tried like maybe two biologic or maybe three. So then at that point, you're like, well, it's only 5 to 10%. Can we get there with complementary stuff, right? And there are some data on acupuncture in osteoarthritis. It's not the greatest, but look, there's nothing else that works, right? So very, very little things that works in osteoarthritis. And so I do like acupuncture. I don't know acupuncture the way my dad at 70 started like learning acupuncture. He tells me about all those meridians and all this, and it's kind of cool to see him. Like it almost looks scientific from from outside. I don't think that I can say that it's exactly scientific, but it's like the studies are actually, when they do studies, they actually can do it against placebo, against sham. And one of the mentor I had at Sloan Kettering is gigantic scientist, very, very evidence-based. He told me, oh, no, there are some excellent studies on acupuncture. And we actually looked at them together, and it would show me what a good study is against, the placebo. It's against sham. And so, yeah, I mean, it's evidence-based. Acupuncture is evidence-based. So then you find the right acupuncturist for you, and then that does help. Sometimes just getting from 90% to 100% or 98%. So I use that. So I have a patient, for example, he will tell me that the reason he's in remission is thanks to acupuncture. So it bothers me a little tiny bit because I think it's the methotrexate I gave him. That being said, look, he's on methotrexate and he uses acupuncture and is in full remission. He has a high CCP, which is normally something like it's an antibody that usually tells us that you're going to need a biologic, and he doesn't need biologic. Great. I mean, is it the acupuncture? I don't know. Like, do we want to test that? Maybe he doesn't want to because he's doing great. So that's like one example. The other example I want to give you is a really, really, really cool story about visualization. I had a patient at Columbia University who had severe lupus and presented with seizure, basically went into the coma because he had seizures. And he was in the neuro ICU, and I was a fellow. And I would enter his room, and because I don't like silence and I don't like the beep, I would be like, hey, so-and-so, this is Dr. Amigues, I'm your fellow, and you're at Columbia University, it's this day. And then one day he woke up, and he was fully hemiplegic. So half of his body didn't work, right? And he would have this beautiful smile, but only half side of his face, and he couldn't function, and he was in his 30s. And I don't know why, but I told him, I said, look, maybe you don't feel the hands, maybe you don't feel your arm and your legs. I would still, even when you're desperate, imagine that it's working, because those connections, there's going to be like, at the time, I don't know that we knew that there was neuroplasticity. I'm not completely sure, but it was a new thing, a new concept. Whereas as a medical student, I had learned that once you lose a neuron, it's over, right? And then you start learning that there's neuroplasticity. So we should not always listen to us, right? And so then he gets out of the ICU, he gets into the regular thing, and then it's time for him to go to rehab. And it's the last day, and I knew I could not follow him because of insurance issues. So he was going to be followed in Brooklyn. Brooklyn. And we were in Harlem. And he takes off the sheet and shows me his feet. And on his feet are sneakers. And he says, Dr. Amigues, I cannot run right now. I cannot walk right now, but I will keep, and I'm keeping thinking that I'm running, that I'm walking. And you're giving me this hope. And so we hugged, and I was like so proud of him. And, at the same time in me, I was like, I really hope this is going to work, And we gave him like all the immunosuppression that he needed, by the way, right? One day, 3 months later, a knock at the door, a nurse comes in at my clinic and says, you are asked in the hallway. And I get out of the hallway, and further away is this patient, and he walks to me without help. And so we hugged. I was so happy. And he tells me, every time that I was feeling bad, I would visualize myself and I would remember the words you had told me. And it kept me going even when I was feeling down. And also, and that letter, I learned that letter, he said, his friends had told him, why are you poisoning yourself with this immunosuppression? He said, I trust the doctor because she told me I could walk again. And so, right, like it's the visualization is helping you continue on that path of healing where you want to go. And so there's a little bit of data of visualization. It's not the greatest, so difficult to share that, but it's difficult to prove also, right? Because you're one brain, like you would have to do two things. But it's to me, this patient just is the perfect example of, maybe it's not that helped the brain, although I'm sure it did, because even athletes do visualization, or performers. As a violinist, you have to visualize where your hand is going to make the proper note, right? You know exactly where it's going, even if you don't have the muscle memory. You're like, I'm thinking of a note and I'm pushing on the violin strings, right? And it's, to me, even if it doesn't help the brain, which I'm sure it does, but even if it doesn't, it's keeping you on the path towards that, on not letting, like not taking the medication. So you're taking the medication, which are going to help you. And so that is a very powerful example to me. It helped me also.
Yeah, I was going to say it's good for the physician as well. And it's actually an interesting juxtaposition because you mentioned burnout before. And I practiced half my career in the United States. So I'm very familiar with the profit nature of American medicine and how you have to work. There are constraints on this side of the Atlantic as well. There's constraints everywhere. Everywhere there's constraints. And I saw that you gave grand rounds on the growing epidemic of psychological distress in healthcare professionals. I'm going to challenge you a wee bit because I've just spent the last few days with a buddy of mine from medical school, and he shares my love for medicine. And we are both a little bit disdainful. And you're talking about visualization. Do you not think that there's a bit of visualization going on here? Negative visualization. Everyone's talking about burnout. Everyone's got PTSD today. I'm probably going to get cancelled for saying this. My dad fought in the Second World War and saw horrific things, and he and his buddies considered themselves to be lucky men for what they got to do. I'm just a bit concerned that we're talking ourselves into psychological distress, but there are people who definitely have burnout. A buddy of mine here in London during COVID, for the first 3 weeks of the pandemic, he didn't leave the hospital. He slept on the floor of his office, lived in scrubs, and he couldn't leave the hospital because he didn't want to leave his patients. And I asked him about it, and he said, about burnout, and he said, Jonathan, that was one of the most privileged times of my life.
Exactly.
Be there to help people.
But I'm on full board with you. That's the thing. It's the autonomy to me that has led to this word burnout. First of all, I'm not sure I like burnout as a word, but it's when you lose the. Okay, so I'm going to share my own reason why I left, right? So I had gone through stage 4 cancer. Then after this, I go through the epidemic, like the COVID. And during COVID, I remember I was like, wow, this is so cool. All the physicians are together. There's no ego. We're all trying to make this better. We're all working so hard to make it better. And I think we really did. I think there was so much incredible research that happened, at least in the rheumatology world. There was so much good that happened from that, right? And after the pandemic, I started seeing people complain and complain. And that's not something that I had seen in the US. I had seen it in France, but we like to complain. That's pretty much how we are raised, right? We learn how to criticize, which is not necessarily negative. But I started listening to it, and at one point I was just like, wow, the truth is that we are removing the pleasure of practicing. So it's not so much that you're burned out in the sense of you're working too much. I don't think so. I think people are working less, actually, if anything, because they are pulling back. It's that we don't have the autonomy that we used to have. We don't have the pleasure of practicing that we used to have. And so the institution I was in is a very good institution. And the way I thought was, if I cannot get that in this institution, then there's no other institution that's going to offer that to me. Like it's just the insurance system. You have that is how it is. If you're getting a certain amount of money from the insurance and like not more, then you have to see more people. And then if you're seeing more people, then right? Like, and so what happened is that we didn't have the help we needed. So we were doing everything. You ask a doctor to be a doctor, they will never be burned out. That I'm absolutely certain. You ask them to suddenly be a secretary, to do prior authorization, which means calls, to explain why you need the medication to someone that didn't go through your training, that's going to give you, it just removes the pleasure of medicine. That's what it is. And I don't think we do that. I think doctors are called to be doctors, right? And so I never counted how much I worked. Never. I don't count how much I work. That's not the point. I think it's the pleasure. I want to have pleasure when I work.
Understood. And I think you've characterized it very well, actually. Changing tack a little bit.
Yeah.
I saw that you've done work on synovial fluid and other biomarker proteins. Can you give me a state of the art? Because, when I was learning about your specialty many years ago, it was things like learning about ANA, anti-nuclear antibody, C-reactive protein, erythrocyte sedimentation rate. I always loved that. We used to actually measure it ourselves on which was kind of fun. Tell us the state of the art. What exciting things are happening in your specialty with that?
So what's really exciting is I think we can now do more than we used to. So it's still not something that we're gonna do on a daily basis. Like it's not. I don't know that we're gonna do it just yet. But yeah, there's more and more study about synovial thickening. So the synovium by itself. So we can do biopsy of the synovium, and I've learned them in England. So that was at Birmingham. So that was wonderful. And so you can do that, and then you can look at the synovium and look if it's looking more RA or some other type of inflammatory condition, if it looks inflammatory, right? And then the synovium, the cytokines, we didn't know how to test the cytokines, I want to say 20 years ago, or maybe even 15 years ago. And now we can test them. And so then I think that the studies are coming where we're going to look, well, can you decide which biologic to choose based on those cytokines? So that's where we're at. So we're really at the beginning of the journey. And then the work that I did is with Dr. Meehan, who's a big researcher in osteoarthritis. So it's really what he's trying to look at. Do patients with osteoarthritis have cytokines that are pro-inflammatory? And, we used to think osteoarthritis was not inflammatory. And we're realizing now that it's actually an inflammatory state also, just not as inflammatory as rheumatoid arthritis.
So, well, I think what that means, Isabelle, is that given the speed that things are happening in your specialty, we're going to have to get you back, in a short period of time and say, guess what? We've worked out how to use these biomarkers to choose which biologic to give to patients. It's fascinating. I always like to finish with a question that I ask all my guests. If a magic genie, you're climbing in the rocks one day and you see there's a little recess, and in the recess there's a porcelain pot, You take out the porcelain pot. You've got your crampons or whatever they banged into the rock. You take it out, you rub it, now pops a genie. And the genie says you've got 3 wishes. What are your 3 wishes for healthcare?
For healthcare. Thank you for asking. Because I was like, for me, I'm like, I don't want to ask anything. I mean, I'll take what life brings me. For healthcare, oh goodness, so many. I would like it to be not for profit, because I think profit should not be in healthcare. So that's number 1. The number 2 is that I wish we trained more physicians so that there would be less need for nurse practitioner and physician assistant. It's a big wish for me. And number 3, I really hope that we're going to do a little bit more work on this, on what's going on in the brain. Because there's a lot that's going on, and I'm really excited about seeing that for healthcare, because I think it would, bring the healthcare to a different level. I mean, those are the 3 ones. I have many other ones.
Well, those are fantastic and very inventive. I'm afraid that's all we've got time for today. And normally I would just say, Dr. Isabelle Amigues, thank you so much for being with us. Thank you for all you're doing for patients. And thank you for your research, for your care. But today I've also got to say thank you for brightening my day. Your joy at being alive, being a doctor, your fascination with our profession is palpable and utterly, utterly delightful. And I can't wait for the next time I'm in Denver, because I'm looking forward to meeting you in person.
I would love that.
To have you here. Real pleasure.
Yeah. Well, thank you so much. Your questions are wonderful. And yeah, I could talk for hours with you, clearly. So thank you. Come to Denver. Yeah. It's the best city. I mean, it's the mountain.
Yeah, it's pretty good. I actually have very good friends who live in Woody Creek, not too far away, towards Aspen.
Wow.
So I've been there a good number of times.
Yeah.
So we will do this game for sure, Isabelle. I'll certainly look you up when I come to Colorado.
Yes, please.
And folks listening in, I presume if you're listening now, you've enjoyed this conversation as much as I have. So please consider subscribing on Spotify or Apple Podcasts. Leave a review. Tell your colleagues. All that helps. Check out the archives. We've got hundreds of episodes on there. And please join us next week on the EMJ podcast for another fascinating episode. I'm Dr. Jonathan Sackia. Thank you so much. Please, everyone, stay safe, stay well, stay curious. Bye for now.